Question 11. Mrs. Della Riva is in her first trimester of pregnancy. She has been lying all day because her OB-GYN requested her to have a complete bed rest. Which nursing intervention is appropriate when addressing the client's need to maintain skin integrity? A. Monitoring intake and output accurately. B. Instructing the client to cough and deep breathe every 2 hours. C. Keeping the linens dry and wrinkle-free. D. Using a footboard to maintain correct anatomic position. Question 11. Answer: C. Keeping the linens dry and wrinkle-free. Question 11. Explanation: Keeping the linens dry and wrinkle-free aids in preventing moisture and pressure from interfering with adequate blood supply to the tissues, helping to maintain skin integrity. Using a footboard is appropriate for maintaining normal body function position. Monitoring intake and output aids in assessing and maintaining bladder function. Coughing and deep breathing help promote gas exchange. Question 12. Marthia, who is admitted in a hospital, is scheduled to have her general checkup and physical assessment. Nurse Timothy observed a reddened area over her left hip. Which should the nurse do first? A. Massage the reddened area for a few minutes. B. Notify the physician immediately. C. Arrange for a pressure-relieving device. D. Turn the client to the right side for 2 hours. Question 12. Answer: D. Turn the client to the right side for 2 hours. Question 12. Explanation: Urning the client to the right side relieves the pressure and promotes adequate blood supply to the left hip. A reddened area is never massaged, because this may increase the damage to the already reddened, damaged area. The healthcare provider does not need to be notified immediately. However, the healthcare provider should be informed of this finding the next time he is on the unit. Arranging for a pressure-relieving device is appropriate, but this is done after the client has been turned. Question 13. Pierro was noted to be displaying facial grimaces after Nurse Cara assessed his complaints of pain rated as 8 on a scale of 1, no pain, 10, worst pain. Which intervention should the nurse do? A. Administering the client's ordered pain medication immediately. B. Using guided imagery instead of administering pain medication. C. Using therapeutic conversation to try to discourage pain medication. D. Attempting to rule out complications before administering pain medication. Question 13. Answer: D. Attempting to rule out complications before administering pain medication. Question 13. Explanation: When intervening with a client complaining of pain, the nurse must always determine if the pain is expected pain or a complication that requires immediate nursing intervention. This must be done before administering the medication. Guided imagery should be used along with, not instead of, administration of pain medication. The nurse should medicate the client and not discourage medication. Question 14. Nurse Marthia is teaching her students about bacterial control. Which intervention is the most important factor in preventing the spread of microorganism? A. Maintenance of asepsis with indwelling catheter insertion. B. Use of masks, gowns, and gloves when caring for clients with infection. C. Correct hand washing technique. D. Cleanup of blood spills with sodium hydrochloride. Question 14. Answer: C. Correct hand washing technique. Question 14. Explanation: Hand washing remains the most effective procedure for controlling microorganisms and the incidence of nosocomial infections. Aseptic technique is essential with invasive procedures, including indwelling catheters. Masks, gowns, and gloves are necessary only when the likelihood of exposure to blood or body fluids is high. Spills of blood from clients with acquired immunodeficiency syndrome should be cleaned with sodium hydrochloride. Question 15. A patient with tented skin turgor, dry mucous membranes, and decreased urinary output is under Nurse Mark's care. Which nursing intervention should be included the care plan of Mark for his patient? A. Administering IV and oral fluids. B. Clustering necessary activities throughout the day. C. Assessing color, odor, and amount of sputum. D. Monitoring serum albumin and total protein levels. Question 15. Answer: Administering IV and oral fluids. Question 15. Explanation: The client's assessment findings would lead the nurse to suspect that the client is dehydrated. Administering IV fluids is appropriate. Assessing sputum would be appropriate for a client with problems associated with impaired gas exchange or ineffective airway clearance. Monitoring albumin and protein levels is appropriate for clients experiencing inadequate nutrition. Clustering activities helps with energy conservation and promotes rest. Question 16. Khaleesi is admitted in the hospital due to having lower than normal potassium level in her bloodstream. Her medical history reveals vomiting and diarrhea prior to hospitalization. Which food should the nurse instruct the client to increase? A. Whole grains and nuts. B. Milk products and green, leafy vegetables. C. Pork products and canned vegetables. D. Orange juice and bananas. Question 16 Answer: D. Orange juice and bananas. Question 16 Explanation: the client with hypokalemia needs to increase the intake of foods high in potassium. Orange juice and bananas are high in potassium, along with raisins, apricots, avocados, beans, and potatoes. Whole grains and nuts would be encouraged for the client with hypomagnesemia. Milk products and green, leafy vegetables are good sources of calcium for the client with hypocalcemia. Pork products and canned vegetables are high in sodium and are encouraged for the client with hyponatremia. Question 17. Mary Jean, a first-year nursing student, was rushed to the clinic department due to hyperventilation. Which nursing intervention is the most appropriate for the client who is subsequently developing respiratory alkalosis? A. Administering sodium chloride IV. B. Encouraging slow, deep breaths. C. Preparing to administer sodium bicarbonate. D. Administer low-flow oxygen therapy. Question 17 Answer: B. Encouraging slow, deep breaths. Question 17 Explanation: the client who is hyperventilating and subsequently develops respiratory alkalosis is losing too much carbon dioxide. Measures that result in the retention of carbon dioxide are needed. Encourage slow, deep breathing to retain carbon dioxide and reverse respiratory alkalosis. Administering low-flow oxygen therapy is appropriate for chronic respiratory acidosis. Administering sodium bicarbonate is appropriate for treating metabolic acidosis, and administering sodium chloride is appropriate for metabolic alkalosis. Question 18. Nurse John Joseph is totaling the intake and output for Elena Reyes, a client diagnosed with septicemia who is on a clear liquid diet. The client intakes 8 ounces of apple juice, 850 milliliters of water, 2 cups of beef broth, and 900 milliliters of half-normal saline solution and outputs 1,500 milliliters of urine during the shift. How many milliliters should the nurse document as the client's intake? A. 2,230. B. 2,740. C. 2,470. D. 2,320. Question 18 Answer: C. 2,470. Question 18 Explanation: he fluid intake includes 8 ounces, 240 milliliters, of apple juice, 850 milliliters of water, 2 cups, 480 milliliters, of beef broth, and 900 milliliters of IV fluid for a total of 2,470 milliliters intake for the shift. Question 19. Marie Joy's lab test revealed that her serum calcium is 2.5 mg/L. Which assessment data does the nurse document when a client diagnosed with hypocalcemia develops a carpopedal spasm after the blood pressure cuff is inflated? A. Positive Trousseau's sign. B. Positive Gvostek's sign. C. Tetany D. Paresthesia. Question 19 Answer: a positive Trousseau's sign. Question 19 Explanation: in a client with hypocalcemia, a positive Trousseau's sign refers to carpopedal spasm that develops usually within 2 to 5 minutes after applying and inflating a blood pressure cuff to about 20 mm Hg higher than systolic pressure on the upper arm. This spasm occurs as the blood supply to the ulnar nerve is obstructed. Gvostek's sign refers to twitching of the facial nerve when tapping below the earlobe. Paresthesia refers to the numbness or tingling. Tetany is a clinical manifestation of hypocalcemia denoted by tingling in the tips of the fingers around the mouth, and muscle spasms in the extremities and face. Question 20. Lab tests revealed that patient Z's Na plus is 170 mg/L. Which clinical manifestation would Nurse Natty expect to assess? A. Tented skin turgor and thirst. B. Muscle twitching and tetany. C. Fruity breath and Gus Mal's respirations. D. Muscle weakness and paresthesia. Question 20. Answer: a tented skin turgor and thirst. Question 20. Explanation: hypernatremia refers to elevated serum sodium levels, usually above 145 mg/L. Typically, the client exhibits tented skin turgor and thirst in conjunction with dry, sticky mucous membranes, lethargy, and restlessness. Muscle weakness and paresthesia are associated with hypokalemia. Fruity breath and Gus Mal's respirations are associated with diabetic ketoacidosis. Muscle twitching and tetany may be seen with hypercalcemia or hyperphosphatemia.